name is Jessica. I'm going to be your student nurse today. I'm going to be taking a head-to-toe assessment of you. Give me 1 minute. I'm going to go gather up my materials, wash my hands, and then I'll be back. Here, I'm going to provide for your privacy. Hello, I'm back. I've gathered all my materials. What I'm going to do is I'm going to ask you a couple questions, do a survey real fast, and see how you're doing, okay? And can you tell me your first name?
Elena.
Your last name?
Howard.
Can you tell me your date of birth?
10/18/1985.
Perfect. And can you tell me the date today?
January 23rd.
And where are you?
Shands.
Okay, perfect. You are alert or rated ×3, which means you know where you're at, who you are, and what the date is today, so that's good. I see that you are in good hygiene condition. You look clean, put together, your clothes look well, your posture looks very great. Your speech is not slurred, you're not stumbling on your words or trying to get things out, so that's really good. The first thing I'm going to do is I'm going to assess sensation in your face. I'm going to touch a spot on your face and you tell me where I'm touching. So can you close your eyes for me?
Forehead. Cheek. Chin.
Perfect. Okay. I see that the sensation on your face as well. You've responded to all the areas that I touched. Now what I'm going to do is test the muscles in your face and make sure everything's moving in symmetry. Can you puff out your cheeks for me? Okay. Can you lift up your eyebrows? And can you smile real big? Okay. Perfect. Now I'm going to check your eyes. If you could take off your glasses for me. And what I'm doing, I'm checking your pupils for dilation and if they react to light and the size of them. Okay. Okay, your pupils are equal and reactive to light. Can you look over there for me? Okay, and can you look at my finger? Good, I see that your accommodation is well, and I look at your eyes and they're nice and clear. They're moist, there's not any discharge or redness, so that's good. I'm going to look in your nose. Okay, I don't see any discharge or lesions in your nose. Do you mind holding one nostril and breathing in for me? Okay, other side. Your airway is nice and patent. There's nothing obstructing it. Here, let me look in your mouth. Okay, and can you lift up your tongue? Alright, your teeth seem to be all there. They seem to be in good shape. There is no lesions under your tongue. There's no lesions in your mouth. That's really good. Your oral mucosa is nice and pink and moist. Okay, and right now, what I'm going to do is I'm going to look at your ears. Your hair. What I'm looking for in your ears are any discharge, any excess earwax, any secretions, sores, Don't see anything in that ear. Nothing in this ear. I see that your ears are symmetric. I'm going to test your gross hearing. And what I'm going to do is I'm going to cover one ear and then I'm going to say a word into the other one. And you just tell me what I'm saying.
Cat.
Okay.
Dog.
Perfect. So your gross hearing is intact. You hear the words that I said, so that's good. What I'm going to do now is I'm going to check your APT, which is your circumference of your chest cavity. I'm going to see that it's a 1 to 2. That looks good. I see that your breathing is not labored. You're not using any accessory muscles. It's very easy for you to breathe. Your chest is not going in and out. Your stomach's not going in and out, so that's very good. Okay. The next thing that I think I'm going to check is your heart. And what I'm going to do is I'm going to listen to the valves of your heart, and I'm going to make sure that there's no murmurs, no palpitations, nothing sounding strange, that it all just sounds the way it should. Move your hair. Okay, the first valve that I'm going to be listening to is the aortic valve, and it is about 2 intercostals down from the midline of your clavicle. And the next one is the pulmonic valve, and that is in the same direction on the other side, in the second intercostal. The next thing I'm going to be listening for is the Erb's point. And this is where the S1 and the S2 are, and that is the third intercostal down. Okay. And then a little bit further down is the tricuspid valve. Okay. And lastly, I'm going to go underneath your shirt. I'm going to listen to your mitral valve, which is right underneath the bra line. Okay, those sounded good. I didn't hear any murmurs, no palpitations. They sounded nice and strong and even. While I'm here, I'm going to listen to your breathing as well. So I see, I'm going to listen to 6 spots on your chest, on your back, and some on your side to hear the sides of your lungs, okay? You can take a deep breath for me. Perfect. Go under and listen. Deep breath. One more. Okay. Now I'm going to listen to the side over here. Deep breath. One more. Good. And this side. One more. Okay, good. If you don't mind turning over a little bit for me, I'm going to listen to your back. And here I'm just listening for the same things, just the back of the lungs. You mind crossing your arms so I can get in between your shoulders? Deep breath. Deep breath. Deep breath. Deep breath. One more. Okay. Your lungs sound clear. There's no crackling. There's no wheezing. I don't hear anything that I'm terribly concerned about. What I'm going to do now is check your spine. And what I'm looking for here is that your spine is straight. There's no signs of a curvature, nothing protruding. I'll just feel it as well as look. Okay, your spine looks great. And again, your posture is very nice. Okay, what I'm going to check now is your carotid pulse. And I'm going to do one at a time that way. You don't fall over. Okay. Okay, their strength is even. They're about a 2 to 3. And then while you're here, I'm going to do your radial pulses. And those are, the strength is even, the symmetry is even. Those are 2 to 3 as well. And I'll do down here, your radial pulses. And those are 2 to 3 as well. And while I'm here, I'm going to check your pedal pulses so we can get them all done at the same time. Those are good as well. You have good circulation. I'll check your posterior tibial pulses. And those are 2 to 3. And these were 2 to 3 as well. Okay, do you mind just turning your legs over this way? Excuse me. What I'm going to do is I'm going to test the strength in your arms. So if you could hold your arms out to the side. Okay, and if you push down. Okay. Very good. Now go like this. I'm going to try to pull and you resist. Okay, and I'm going to push. Very nice. Now can you put your arms above your head? Okay, and can you put them behind your back? Okay, can you put them out to the side? And can you move them all around? Okay, perfect. I'm going to test the strength in your legs. So push up on my legs. On your legs. Okay, now push down. Push down. Okay, now let's do your calves. Okay, now push out. Okay, and while we're here, let's get your feet going. Push down on your toes. Okay, push up. Perfect. If you could stand up for me. What I'm going to do is have you just walk over here. I'm just checking your gait to make sure, very good, come back. I just want to make sure that you are not limping. It's not hard for you to walk. You don't fall when you walk. Okay, so I'm going to try to push you forward. Okay, now back. Great, I see that you have great balance. Can you sit down for me? Okay, let me see your hands. What I would normally do is check your capillary refill, but being you have this great manicure, I can't get to that. So, it looks good if you have one. Let me see your toe down here. Great. And can you move your ankle around and that side too? Okay, good. Okay, the next thing that I'm going to do is I'm going to test your hearing. Did I already test your hearing? I'm not sure. Let's do it again to make sure. I'm going to say dog. I'm going to say a word and you tell me what it is.
Penguin.
Okay. Monkey. Wonderful. Okay, so now what I'm going to need you to do is I'm going to test your, listen to your stomach. Listen to your bowel sound. So if you can come down over here and lay down on the bed. I'll have you laying down. I'm just going to check your arms for your temperature and make sure it's not too hot or too cold. Your arms seem to be symmetric. Perfect. Okay, so what I'm going to do now is I'm going to listen to your abdomen. I'm going to listen to your bowel movements, make sure that they're moving and the sounds are good, that they're not too many sounds or too little sounds. So do you mind if I lift up your shirt? Okay. Great. So what I'm going to do is I'm going to inspect your abdomen and I'm going to make sure there's no scarring, no obvious lesions or protrusions. It's nice and flat. There's no inward curvature and there's nothing protruding out. So you have a great belly. So what I'm going to do is I'm going to listen. I'm going to listen to the right lower quadrant first, because that's where all the activity is, and then I'm going to go around to the other quadrants. Go to the right upper quadrant. And the left upper. Left lower. Okay. Sounds were good. There's a lot going on in there, like there should be. What I'm going to do is I'm going to palpate your stomach, which just means I'm going to push down on it, and I'm going to be looking for any masses, any protrusions, just anything that I can feel. Let me know if you feel any pain. I'll be looking at you to assess that, to see if you make any painful gestures, but just let me know if you feel anything. Any pain or anything? Great. So while I have you laying down here, what I'm going to do is I'm going to come down to your calves and I'm going to check for edema. I'm going to look for any swelling, any tenderness, any heat, any excessive heat there. And then I'm also going